Hi, I'm Dr. Richard Pitcairn, and I'm going to show you a dialogue I did with Dr. Lisa Melling, who is a veterinarian that took our training program in homeopathy and has gained quite a bit of experience. And she's going to give us an introduction to what homeopathy is. So you can come out of it, hopefully, with some sense of what type of medicine homeopathy is and how it's applied. So Dr. Melling, she did her undergraduate work and got her science degree in animal science in Iowa State University in 1999. And she graduated from Tuskegee University Veterinary Medicine School in 2004 and had a special interest in animal behavior and emergency medicine. And this is an interest that has carried on ever since then. She worked part-time in emergency medicine and critical care since 2006 and is still doing that work because this really is something she loves to do. In 2007, Dr. Melling co-founded Best Friends Pet Wellness, which was a house call practice in Ann Arbor, Michigan. And she, as she worked, became somewhat frustrated or disappointed maybe at the limits she ran into with the medicine she'd been taught, which is what promoted her to look for some other things to do and brought her to the professional course for veterinarians in homeopathic medicine. And she took that course and finished that in 2010. So she's been doing this work for 10 years. She became certified as a veterinary homeopath by the Academy of Veterinary Homeopathy in 2011. She has presented quite a bit. She's been very active in presenting and promoting the work. And she's presented at quite a few meetings, the annual meeting that we do with our organization. Once a year, we have a conference, 5-day conference. And she's also presented at the Academy of Veterinary Homeopathy, American Holistic Veterinary Medical Association, published a number of articles in different journals. I won't go into all of them, even Dogs Naturally and Pet Wellness magazines. Been a guest lecturer at Michigan State University School of Veterinary Medicine and at their Integrated Medicine Club. And she's been aboard of the Academy of Veterinary Homeopathy since 2015, which is our professional organization that represents our work. She's done a number of webinars, so she has some experience in this. In 2015, she moved to Traverse City, if I'm pronouncing it right, in Michigan, and established Good Harbor Holistic Veterinary Care. And it offers homeopathy, nutritional advice, and behavioral counseling for small and large animals. So in 2019, the spring of 2019, she became certified in veterinary spinal manipulative therapy and added animal chiropractic treatment to her homeopathic. So she has quite a few skills. And I just want to point out that when somebody does this move from their usual practice into primarily alternative homeopathy and other things, obviously they're very interested and enthusiastic about it. So we're very fortunate to have her here to share with her what she understands about it. So I'm going to turn you over to be a presenter here. We will, you can take off with your slides here. Let me find your, here we go.
Okay. So Richard, thank you so much for that great introduction and for hosting this tonight. Thank you to everyone who worked a full day and is now attending a webinar at night. This webinar is an introduction to veterinary homeopathy. We have it listed as being co-presented with Dr. Sarah Stieg because a lot of the cases that I'm going to present actually came from her. And Sarah and I wrote this webinar together. Dr. Sarah Stieg is a veterinarian. She got her degree in the United States, but now practices in North Yorkshire in England. So she brings a lot of really interesting cases to this presentation, and she also does a lot of horses. So let's get started. This is me. I live in Traverse City, Michigan, which is a resort destination. Traverse City is in the northwestern part of lower Michigan, the lower peninsula. And I moved here 4 years ago from Ann Arbor, Michigan. And I renamed my holistic practice from Best Friends Pet Wellness to Good Harbor Holistic Veterinary Care. And Good Harbor is a very quiet bay of Lake Michigan that's 4 miles from my house. And it's very dog friendly, and it's a very beautiful, safe, quiet place to swim. And I thought that was a good name for a holistic practice. The services that I offer, as Richard said, are classical homeopathy and also veterinary spinal manipulative therapy, which is a fancy term for animal chiropractic. I also include behavior services. I am very well versed at teaching people how to prepare and share their own meals with their pets. And so I also have a big focus on nutrition. And I specialize in helping people feed the same thing to their pets that they eat themselves. So, for example, I'm plant-based, and so I feed a plant-based home-prepared diet to my animals, and I help tailor nutritional needs for pets as well. And I also work a couple of days a week at the local critical care facility called Bay Area Pet Hospital. So the goals of this presentation are to compare allopathic approaches to illness with the homeopathic approach. We're also going to discuss the importance of the vital force and something called the law of similars. We're going to talk a bit about the origins of homeopathy and how we prepare our remedies. And remedies is a term that we use interchangeably with homeopathic medicines. We're going to discuss how you can apply this in your veterinary practice. And then we'll also differentiate between the remedies that are used for acute versus chronic disease treatment. And then, of course, we're going to take all of this knowledge and show you how to work up these cases. We'll give you some case presentations that show acute and chronic prescribing and shows you not just how to address symptoms of illness, but to actually cure the disease that's causing the symptoms with your homeopathic medicines. We'll also tell you what your options are as a veterinarian or a healthcare provider for homeopathic training, certification, and continuing ed. And for those of you who want to start right now, I'll give you a recommended reading list and some resources. So I think we need to start out by defining the difference between allopathy and homeopathy, because I get this a lot where people confuse the HO terms. So they'll confuse holistic with homeopathy, and they'll use them interchangeably, but very few people talk about the definition of allopathy, which is interesting because that's how most of us were trained in veterinary school. So allopathy, or contraria contraris, is based on the law of opposites, and it's a method of treating disease by using agents that produce effects that are different from those of the disease treated. Well, what do we mean by this? Well, this is what we learned in vet school. The goal is to understand the pathophysiology of the illness so that we can name it. And then once we've named it, we've put it into a certain category that tends to have similar disease symptoms in each category. So for example, the most common things we see with renal disease are polyuria, polydipsia, vomiting, loss of appetite, Cushing's disease, PUPD, non-traumatic alopecia, elevated ALK phos. So we name these things, and then we put the disease in a category, and then we follow directions for suppressing the disease symptoms. So for example, every patient with Cushing's disease gets a certain form of medication to treat their condition. And these are usually the symptoms of the illness rather than treating the underlying cause of the condition. So We suppress the disease symptoms using drugs. We use antibiotics to suppress infection. We use anti-inflammatories to address swelling, and then antiemetics for vomiting. And then for those more severe, scary cases, we use immunosuppressants for autoimmune diseases. And as we all know, frequent repetition of the medicine is often needed. And if we discontinue the drug, the symptoms will often return. And then with every drug, there are side effects, which are considered the undesirable effects of the drug on the patient. And then we have to deal with those as well. In contrast, homeopathy is based on similia similibus curantur, which is the law of similars, which means that like cures like. And the concept behind homeopathy is that if we take a medicine that can produce morbid symptoms in a healthy patient, that medicine will remove similar symptoms occurring as an expression of disease in the ill patient. Now, let me break this down for you to make it a little bit easier to understand, because homeopathy is such a foreign concept to us. Any medicine that can produce morbid symptoms, and morbid means can you see the symptoms in a healthy patient. So these are medicines that a healthy patient would volunteer to take until they develop symptoms of illness. And then we categorize those symptoms in those healthy patients to understand what the effects of our remedies will be. Now, we choose these medicines that have similar symptoms in the healthy patient as those suffering from illness. And when we give those in a homeopathically prepared form, we can remove the expression of disease in the ill patient without causing harmful side effects. Now, the other thing that I like so much about homeopathy is that the homeopathic remedies are individualized for each patient to match their own signs of illness. So, for example, you may have 3 patients that have what allopathic medicine would consider renal disease or hyperthyroidism or parvo or feline upper respiratory complex. And each of these patients may receive a different remedy even though they have the same named allopathic condition. And that's because homeopathy looks for the tiny little details that make one remedy stand out over another, so we can individualize the remedy, make it a perfect match to that patient's symptom picture, and remove the cause of illness. So to understand how this works, to go from an approach to medicine that suppresses the symptoms of disease to an approach to cure, which removes the underlying cause of the illness, we have to understand a concept called the vital force. And we don't really discuss this in allopathic medicine very much, but we hear about it in Chinese medicine. It's called qi. And in homeopathy, it's called the vital force. This is the energy that maintains the life in the individual. And I guess the closest thing that I can think of that we can equate to this in allopathic medicine would be the immune system. But it's not an exact match for what the vital force is. The vital force maintains balance and normal function in the body. And anytime we have symptoms in a patient, these symptoms are merely the vital force's response to imbalance, which we call disease, and the vital force's attempt to return the patient to normal functioning. So when we're working up a patient, we're looking at their totality of symptoms. We're not trying to categorize the disease. We're trying to find out all of the symptoms that the patient is suffering from so that we can identify one remedy that catalyzes a vital force to begin healing in the patient. The other thing that I really like about homeopathy is that we're recognizing that most of the time, with a little bit of help, patients can heal themselves. And sometimes when we see these symptoms, it's because the vital force is stuck. It needs just a little nudge from homeopathic treatment to begin moving in the right direction of cure. But homeopathy really respects the vital force's ability to heal itself. And in the homeopathy course, I noticed there's a couple of you who are logged on who are graduates of the homeopathy course, and I'm so glad you're joining us tonight. We would do this chant when Dr. Stieg and I would lecture. We would say, who's doing the work? The vital force! And so it's not homeopathy that's doing the work. The remedy stimulates a healing response, and then the patient is the one that does the healing. So there are a couple of examples that maybe you've already thought of as you're listening to me talk about homeopathy in modern medicine, where we use a similar approach, where we use small doses of a similar substance to stimulate a healing reaction in the body. So for example, high doses of radiation will cause cancer, but small doses of radiation are used to treat cancer. Large doses of digitalis will cause heart arrhythmias, while small doses of digitalis are used to treat them. And then another example that many of us are familiar with is the use of Ritalin for hyperactive children. If you give this drug to someone who doesn't have a hyperactivity disorder, you will actually cause hyperactivity as a side effect in that patient. But if you give Ritalin to a hyperactive child, the similar substance effect of that medicine will treat the hyperactivity in the child. So how did homeopathy get started? Well, homeopathy dates back much farther than Samuel Hahnemann, but Hahnemann is considered the founding father of homeopathy because he actually organized a systematic approach to this form of therapy. So he was a German physician who lived between 1755 and 1843. And he was a brilliant, brilliant physician. And when he graduated medical school, he actually found, after a short amount of time in practice, that it was inhumane and unethical for him to continue the practice of medicine because the drugs and therapies of his time caused his patients so much suffering. So instead, because Hahnemann was fluent in many languages, he left medicine and started translating medical texts. And he was translating a particular text in 1789 that was written by someone who is the equivalent of Plum today. So Plum wrote the Drug Veterinary Handbook. And imagine if the person who's translating the text of Plum, the Veterinary Drug Handbook, to another language, and that translator reads something that he disagrees with. And so he not only writes a footnote, but he argues that the physician is wrong in his conclusion about the medicine. So that's essentially what Hahnemann did. He was writing a translation that was written by a very well-known doctor on a drug called Peruvian bark, which is also known as cinchona or China. And Peruvian bark was used to treat malaria. And this author was concluding that the treatment worked because of the Peruvian bark's bitter astringent properties. So Hahnemann, as he's translating, writes his own footnote that disputes this conclusion, and he says, well, this doesn't make any sense. There's other more bitter roots out there that aren't effective in treating malaria at all. So what did he do? He goes ahead and starts taking doses of the bark until he develops symptoms that are an exact match to malaria. And his own conclusion is that the bark is curative, not because it has a bitter property or astringent property, but because it caused symptoms that were similar to those of the disease. So now he's really interested in this concept, and he starts investigating to find out if there's other similar properties in other roots and plants that he might be able to use to find a treatment that's more effective in treating his patients with less side effects. And before I move on to the next slide, I want to talk about this picture for a minute, because in the beginning, Richard was talking about how effective homeopathy is in the treatment of epidemics and pandemics. And this statue is in Scott Circle in Washington, D.C., which is a very short distance from the White House. And this is the only statue that praises a medical practitioner for his work in treating patients. And we do a lot of study of the history of homeopathy in the Pitcairn Institute course in veterinary homeopathy. But it's amazing if you compare the numbers of how effective homeopathy was in treating severe epidemics like influenza and yellow fever with homeopathic remedies and the very extraordinary success rate. So this statue was a thank you to Hahnemann from all of the patients that he saved in the epidemics with the use of homeopathy. So I mentioned that one of Hahnemann's concerns was his fear that he was doing more harm than good with the medicines of the day that he was using to treat his patients through his allopathic training in medicine. So as he starts investigating these different plants to see if he can use remedies in nature or different medicines to treat his patients, he realizes that the more he dilutes the medicine, the gentler it is on his patients. But over time, he realizes that even diluting the medicines is not enough, and these patients are still having side effects, and he's still really conflicted about using these medicines and harming his patients. So he starts noticing in his careful research that if he not only dilutes the medicine, but he shakes it, initially he was intending to just mix the medicine in solution, he finds that the more he dilutes the medicine and shakes it, that the medicine acts more gently but more effectively on his patients. So he starts researching this concept and eventually calls it potentization, which is a serial dilution of 1 part medicine to 99 parts distilled water and then shaken vigorously, which is a process we call succussion. And he repeated this process to different strengths, which we call potencies in homeopathy. And he found that the more he diluted and succussed the medicine, that the gentler it was on the patient and the deeper and more long-acting it was. So he found that the higher potencies, such as 200 Cs, 1M, 10M, 50M, and MM potencies are the high end of the scale, would act a long time and very deeply in the patients and required less repetition. So as I mentioned before, homeopathy respects the body's innate ability to heal itself, and homeopaths recognize symptoms in the same way that a car mechanic sees the check engine light. So when your check engine light comes on, you have the option, you can figure out if there's something wrong with your engine, take it to a mechanic, ask them to locate the underlying cause of the check engine light coming on, or you can unplug the fuse, which removes the symptom of the problem but doesn't address the underlying condition. So homeopaths view symptoms like a mechanic views a check engine light. It's a sign of a deeper problem within the body, and we use these symptoms as a clue from the vital force to guide our remedy selection. And our goal is always to resolve the symptoms by treating the underlying imbalance and not to suppress them. So, following Hahnemann's recommendations and his research, we use small doses of substances that exactly match the symptoms in the patient. And our dose repetition, unlike allopathic medicine where we put an animal on a drug and we say every 12 hours for 7 days or every 12 hours for 6 weeks, our dose repetition depends on the patient's response, because what we're looking to do is stimulate and strengthen the immune defenses in the patient. And the overall result is an improvement in their general health, because when we address the underlying cause of the illness and we resolve the symptoms that way, the patient's vital force gets stronger, because we're teaching it to heal itself rather than suppressing the symptoms or the signs that it's giving to tell us something's wrong. So now I bet you're all excited, and you're wondering what the applications are in veterinary homeopathy. Well, we have multiple different approaches to illness with homeopathy, and we have different remedies for acute illness and infectious disease and injuries and trauma compared to chronic disease. One of my favorite things with homeopathy as a practice owner is sometimes it's about the bottom line, and that's all there is to it. And one of the things I found so frustrating in the first few years I owned my own practice when I didn't offer homeopathy is I had to stock different size milligram tablets of different kinds of antibiotics depending on the patient that I was treating. Some antibiotics were better for cats. Some antibiotics were better for dogs. And then there's your pocket pets. What medicines can you use for pocket pets that are safe to use, or wildlife, or horses? And so for those of us who treat multiple species, one of the challenges in stocking your pharmacy is that you've got to have so many different drugs and dosages for your patients. With homeopathy, you can have one homeopathic remedy that can treat multiple species, going all the way from this cute little possum up to a herd of cattle, wildlife, horses, exotics, and small animals that you see in your clinic every day. Richard, can you go through and remute everybody? I'm getting a little bit of feedback.
Yeah, I think people are muted, but let me check here.
Or be careful not to mute me. But I think some people are logging on.
My only choice is to mute everybody, and you'd have to unmute.
Okay, I'm ready to do that.
Let me go here, and I'll check while you're talking and see if I can see somebody's unmuted.
Okay. So, continuing on, sorry about that interruption, you guys. I'm sure you're all hearing the feedback, too. Okay, so the homeopathic goal is to find the remedy which produces the same symptoms in a healthy patient as the symptoms that are seen in their sick patient. So in our case evaluation, when we're working up a case, our goal is to identify the symptoms as acute or chronic disease, which will then determine which remedy we select and the frequency of dosing. So when we're prescribing on acute illness, we're going to use a simple case analysis of the patient's current symptoms that they're showing. And when we use a homeopathic remedy, we're going to see rapid improvement of all of our symptoms, oftentimes within 5 to 10 minutes of giving the remedy. In contrast, when we're prescribing on chronic disease, our case analysis is based on the totality of the patient's symptoms, both historical and current. And so what we're looking at is we see with chronic disease that every symptom a patient has ever had in their entire life is a response of the vital force to correct an underlying imbalance. And so every single one of those symptoms is important. So for example, an ear infection that a dog had 5 years ago is really important to a homeopath. Episodes of vomiting or recurrent diarrhea or bladder infections and how those were treated is really important when we're taking a chronic disease case. And when we choose the right remedy that fits the patient's current and historical symptoms, we're finding that that key is resulting in a gradual return to health when we find that right remedy. So we'll see a rapid return of general well-being. So for example, a patient that's suffering from chronic vomiting and diarrhea, immediately with a homeopathic remedy within the first couple of days, will start to have a return of appetite. And if they were lethargic or quiet, we start to see a return of their vitality and their energy level. And then gradually, with the homeopathic cure that our remedies bring, those patients' symptoms slowly resolve and then don't reoccur again. So let me give you some examples of things that homeopathy can treat. We've got trauma, shock, and wounds, corneal injuries, very successful, post-operative analgesia. I worked in a homeopathic practice for a year in northern Indiana, and we used nothing but homeopathic remedies after our surgeries to recover our patients. I did some studies on objective analyses of the patient's heart rates and respiratory rates and calculated their pain responses to treatment, and overwhelmingly saw excellent pain control with our homeopathic remedies after surgery. Other things that we can treat, gastroenteritis, which can be chronic, but a lot of times we see it flare up as acute illness. And then a lot of things that we see every day, upper respiratory illnesses in dogs and cats. This can be anything from bronchitis, feline upper respiratory complex, kennel cough in dogs, and then the bane of every equine vet's existence, colic at 2 a.m. So let me give you an idea if you're taking the course. I know that there's several of you who are watching this webinar who are already enrolled in the 2021 course. I'm really looking forward to teaching you. The PIVH, which is the Pitcairn Institute of Veterinary Homeopathy, there's 5 4-day in-person sessions. And in the first 2 sessions, we're going to teach our students and our colleagues to learn to recognize the remedies and their key notes, which are often indicated in the treatment of acute problems. So for example, we'll teach you about remedies that are commonly used for certain conditions, like arnica is very popular for the use of shock, trauma, and postoperative analgesia. Calendula is our go-to remedy to stimulate wound healing and reduce scar tissue. And then we have a group of remedies that are very well known for gastrointestinal disorders, including Nux vomica, Arsenicum album, Pulsatilla, and Cinchona or China, what we talked about a few slides back. We're also going to start teaching students to work up a case, use the repertory, and learn to create a symptom analysis. And so the repertory is our collection of symptoms that spell out which symptoms are represented by each homeopathic remedy. And then once we teach you how to do these analyses, these homeopathic symptom analyses by hand, we're going to show you how much easier it is to use a computer program. And I'll show you how the computer program is applicable in this presentation. We'll also teach you how to select potency, which is the strength of your remedy, and how to decide your treatment schedules. And then there's the bread and butter of what most of us treat in veterinary medicine, which is chronic disease. And some examples of chronic disease that respond really well to homeopathic treatment are allergies and ear infections, feline lower urinary tract disease, and cystitis. All of our abbreviations for arthritic changes and developmental changes in the joints, intervertebral disc disease, degenerative joint disease, and arthritis. And then all of the immune-mediated conditions, such as immune-mediated fever, masticatory myositis. I'll also throw in a couple of other things I've treated with homeopathy, IMHA and IMT, inflammatory bowel disease, malabsorption disorders, and the big C, cancer. And then, once we start our introduction into chronic disease, sessions 2 through 5 are going to focus mostly on chronic illness. We will teach you to recognize all the symptoms in a patient as an expression of chronic illness. We'll teach you how to choose your remedies based on the symptoms throughout the patient's timeline. So as I talked about before, a patient who has a history of ear discharges, cystitis, vomiting, and a ruptured CCL will only have one homeopathic remedy because there is a remedy out there that matches all of these symptoms. Even though it's hard to see that they're related, we absolutely see them as related because they're occurring in the same patient. And then to make your life easier, we're going to teach you to use computer software programs and reference material to make this process fast and to guide your prescription selection. So when we're learning remedies for chronic disease, we'll teach you which remedies are most indicated because there's definitely some groups that fit better into the acute treatment versus the chronic treatment. And then we'll help you through a problem-based learning strategy to develop an approach to your cases and decide on your follow-up prescriptions. Each course, each session will have an advanced study of case analysis. We'll present cases really in-depth. They will come from the faculty instructor's own practices. We'll show you how to identify which symptoms are most pertinent in the case, how to choose your prescription, and evaluate your patient's response to treatment. And then all of this is based on understanding how homeopathy uses all of the symptoms in the patient to identify and treat the imbalance in the vital force to restore health. Because as we say in the course, who's doing the work? The vital force. We're teaching the body to heal itself. So in summary, effective homeopathic prescribing successfully restores health using a single remedy to treat multiple symptoms in the patient. And the result is that we improve our patients' well-being and general health while also decreasing their susceptibility to future illness. This sounds great, right? So why should you add homeopathy to your practice? Well, it allows you to practice using one medicine per patient at a time. So instead of sending home multiple prescriptions and wondering which one's having an effect, and if you're seeing side effects, which one's having those side effects, we get to use one medicine per patient at a time. And for those of you who are treating animals that are difficult to medicate, such as wildlife, cats, horses, you're oftentimes not repeating your remedy very frequently. In many cases, one remedy dose can have a curative effect. And in chronic disease, instead of giving a medicine every 12 hours, we'll have a dose create lasting responses for sometimes weeks to months. And the idea behind all of this is we're stimulating a healing response instead of suppressing symptoms of illness. And one of my favorite benefits to homeopathy is we're not doing harm to our patients when we're using this form of medicine. If you're using your remedies correctly, there are no undesirable drug side effects. We will see a rapid return of our patients' well-being. Those that were lethargic or anorectic become energetic again and start eating. And for all of us business owners, this is very inexpensive to stock and prescribe because the same remedy can be used across species. So now let's get down to the fun part. Now that you understand the basics, let me show you how this is used in a homeopathic practice. So for the purpose of this presentation, each case example is going to briefly demonstrate how we go through the symptoms and select the most important symptoms for our remedy analysis. I'll show you how we work up a case, and in each of these cases, I'm going to show you how to do this with computer software. We'll show you how we chose the prescription and what the keynotes were that made us choose that remedy. And then we'll guide you through our dosage selection, which is how frequently we repeat the remedy, and the potency, which is how strong the remedy is. And remember that as we ascend, as we go up in potency, so 6C, 30C, 200C, 1M, those remedies have been further diluted and succussed. So even though there's smaller traces of the medicine left behind, this process makes them stronger in their effectiveness of treatment and gentler on the patient. And then we'll also discuss how we selected our follow-up plan for the patients. So this is a case from my own practice. This is when I was practicing in Ann Arbor. Riley is, at the time, almost 6-year-old spayed female golden retriever. And she was my last house call appointment of the day. She lived close by. Her owners lived close by me. And I had it in my head that this 6 o'clock appointment was going to be simple because I was just stopping by to check on how she was healing. She had a TPLO performed to treat a ruptured left cranial cruciate ligament. And I was under the impression that I was going to her house to remove her sutures. So as I'm there and I'm doing a gait analysis and evaluating her lameness, and I'm getting ready to remove her sutures, the owner says, "Oh, hey, Doc, by the way, do you have time to treat her for some vomiting that started about 30 minutes after dinner?" And I said, "Oh, 30 minutes after dinner, like tonight?" And he said, "Oh, no, this started yesterday at dinner." So, of course, This is just how our days always end up, right? Not ever what we think the appointment's going to be. So now I start asking Jo, Riley's owner, tell me about her symptoms. And I want to know all the details. I want to know what her vomit looks like. I want to know whether or not this is vomit versus regurgitation. I want to know if she's eating. Is she still drinking? Is there a change in her appetite or how much water she's drinking? And then what else is she doing that's a change in how she normally behaves? Because sometimes we can use a change in a patient's behavior as a guide to remedy selection. So this is what her owner tells me. He says, well, her vomit contains partially digestive food, which I sure think is interesting since she refused breakfast this morning and then later vomited phlegm with mucus. And then when he got home from work today, she went outside and she ate grass and she vomited 3 more times within a short time period. Normally, she drinks a lot of water, and today she's not drinking any water at all since she started vomiting last night. So there's several key things in here that are very useful. And then I asked Jo, is there any possibility you know what caused this? Did she get into the trash? Did she eat something she can't digest? And Jo says, oh no, we keep a really close eye on these dogs because they can get into trouble. There's absolutely nothing that she's gotten into. So I decide that I have enough symptoms to choose a homeopathic remedy. And I do an analysis in my computer program just to make sure that I'm accurate in my memory of these remedies. And so this is what the computer program looks like when you do an analysis. I have a computer software program called Radar Opus. And what we do is we type in the patient's symptoms, and then the program translates them into something called rubrics, which is the characteristic symptoms that the patient is displaying that will help guide us to the fitting remedy. So this list here is the list of symptoms, and I was trying to make it as clear as possible and as detailed as possible, because you can see here that when I use vomiting in general, this number in parentheses is 97, and so that means that there's 97 remedies that fit vomiting. And here, a patient who is thirstless, there's 84 remedies that fit that symptom. So gosh, I'd really like to narrow it down, and this dog is doing something that's pretty interesting. She's vomiting her food after she eats it. Well, that narrows it down. That narrows it down to only 10 remedies. And then the owner told me that another thing that she's vomiting is mucus, which has 59 remedies. So here is my list of remedies that most closely fit all of the symptoms in the patient. And then the program allows you to use color gradation based on intensity of how well this remedy matches the patient's symptoms, or you can use a number scoring system, which Dr. Stieg uses in her cases, and I'll show you that in a couple of slides. So up here, these are abbreviations for the remedies that most closely fit the patient's symptoms. So we have ARS, which is short for Arsenicum album, Pulse, which is short for Pulsatilla, Nux V, which stands for Nux vomica, and Phos, which is short for phosphorus. And the darker the squares and the higher the number up here, the more closely this remedy is a fit for all of the patient's symptoms. And then you can't just go on your computer program, right? Because occasionally I'll work up a case and there will be a remedy way out here, 8 or 9 or so, that ends up being a lower gradation, but actually ends up being the most well-fitting for my patient's symptom picture. And how do we know this? Well, we're going to train you really well in the PIVH course. And so you're going to learn to recognize what patients look like with remedies. And so all of Riley's symptoms very closely match Arsenicum and Pulsatilla. However, Pulsatilla has a very characteristic symptom, which we call a keynote, where almost all of the symptoms that a Pulsatilla patient will exhibit have a keynote of thirstlessness with their complaints. So I felt like Riley, who is normally a really good water drinker, since she's become ill, has not been drinking any water. That guided me to the choice of pulsatilla. And I gave her a 200C potency in a single dose. I left the owner with a couple more doses. I removed her staples from her surgery, which was the whole reason I'd gone out there in the first place. And it's already 6:15, 6:30. So I tell the owner that I'd like to have a follow-up within a half an hour of her symptoms and her treatment to see if any of the things that we're treating are getting better. Because remember, when I tell you that we treat homeopathy, we treat symptoms with homeopathy, in acute cases, these patients get better fast. And if she's not getting better fast and she's continuing to vomit, I'm going to need to intervene more, right? Can't let this dog continue to vomit for another 24 hours. So, prescribe pulsatilla 200C, leave my phone on, go home. And as I'm driving away, Joe calls me and he says, 5 minutes after you left, Riley walked outside and she passed a sock in her feces, which, if you remember in my intake questions, he assured me that Riley had not gotten into anything and there was no way she could have eaten something that was causing the vomiting, right? We hear this all the time. So 6 p.m. progress report, he tells me, so this is maybe like 10 minutes after I've left, 15 minutes later, he says, well, she hasn't vomited again, but she had some more loose stool and there were 2 more socks in it. So I advised him to feed her 1/2 of her normal meal and call me in an hour with an update. Because what I'm looking to see is once he starts putting food in this dog, does she start vomiting it back up or not? So 7 p.m. progress report, he says, well, Riley's back to normal. She ate well. She's not showing any signs of nausea. And would you believe I found 3 mismatched socks in the laundry pile? So that, just to summarize, that was 1 dose of a homeopathic remedy that acted within 5 minutes to stimulate the gastrointestinal tract to fix the problem that was causing 24 hours worth of symptoms. 1 homeopathic remedy, after 24 hours of vomiting, thirstlessness, loss of appetite, treated the symptoms by stimulating a healing response in the patient so that she could get that foreign body out of there without needing a surgeon. So what we're trying to do is show you how homeopathy can be used across species, because we know that not everybody treats the same thing in their practice. For those of you who have clients or who have backyard chickens yourselves, this is a case from my practice. I have several clients who have either backyard chickens or they have chickens as part of a business, such as organic eggs. So this was a case that I saw in February of 2015. This was when I still lived in Ann Arbor. Now, February of 2015 was a rough month in Michigan. We had sub-zero temperatures for about 10 days. And on this day, one of my favorite clients called me, and she said that she had an 8-month-old speckled Sussex hen that was very ill. She was unthrifty, she had a barking cough, and she could actually hear her wheezing when she was standing several feet from her. She also was demonstrating an increased respiratory effort that seemed worse in cold air than when she was brought inside, because of course this owner brought her chicken indoors so that she could take care of her. So based on these symptoms, which you'd think would be really limited because we're dealing with a chicken, I actually got a lot of really great symptoms. We have a cough that occurs when breathing deeply. We have difficult respirations. We have a cough that's worse in cold air. We have a barking cough and wheezing respirations. And so again, these are our rubrics. This is the number of remedies that fit this symptom or this rubric. And so you can see this rubric. Doesn't really narrow things down. That's 259 remedies. I'd sure hate to have to read all of those before making a decision. But when we combine every single one of these rubrics or symptoms, it narrows down our remedy choices, and our top ones are HEP, which is abbreviated for Hep-Arsulf, Cali-Bi, which is Cali-bichromate, and then bromium, and then this one over here is lycopodium. And my list was actually a lot longer than this, but I shortened the list because I can tell you that the remedy that this chicken needed is right here at the very top, because Hep-Arsulf is indicated in cases of bronchitis and pneumonia and asthma that are worse or aggravated in cold, dry air. And so when this chicken was brought inside to moist, warm temperatures, her symptoms improved. But when she was outside in cold, dry air, sub-zero temperatures, her symptoms worsened again. So now you might be saying, Dr. Lisa, how in the heck do I medicate a chicken? Well, you can take the pellets and dissolve them in filtered water and then draw them up in a syringe or in a spoon. You can scoop them and then just drip a couple of drops onto the chicken's beak, or use a syringe and squirt just a few drops into their mouth. And all they need is to get a couple of drops onto their mucous membranes. If the chicken is drinking, you can put it in the water, but once you see the chicken drink once, you want to remove that water source, dump it out, and refill it with just water and no remedy. Because every time that chicken drinks from that water source, if the remedy's still in there, they'll be redosing themselves. And while we don't see a lot of side effects with homeopathy, we can see what's called an aggravation of symptoms if you repeat your remedy too frequently. So I asked this owner, because this is an acute condition, to give me a call in a couple of hours. And she's very well educated on the use of homeopathy, and so she knew what to do. I asked her to give one dose every 2 hours until she noted improvement. And I said, if you don't notice improvement after 3 doses, you need to stop and call me. So she, by the second dose, the owner had noticed significant improvement in her respirations and coughing. And she called me 2 hours after the second dose had been given, and she said, you're not going to believe this. She's making normal chicken sounds, and she's got improved energy and activity. And the only thing the owner was still seeing was that her wheezing was persisting. And so I advised her that this is a normal curative response. We can't just make all the symptoms disappear when there's inflammation in the lungs, so it makes sense that the breathing and the coughing would improve, but you wouldn't see all of the pulmonary changes and the inflammation just magically disappear. We need to give the body time to heal that. So I said to the owner, this is a curative response. I want you to hold off on dosing and only repeat it if her improvement stalls or her symptoms worsen. And I promise you that 2 days after this remedy, in February, we didn't have green grass. And so I need you to know that this picture was taken in June of that year. But 2 days after treatment, the owner called to tell me that her hen is doing great. She never needed to give more than the 2 doses that she gave, and all of her symptoms have resolved. She has great energy, and she's planning to return her to the flock outside. So 4 months later, when I was out there to do wellness exams and a homeopathic treatment for one of her dogs, I said, hey, Cynthia, where's that speckled Sussex that we treated this winter for her bronchitis? And so that's when I snapped this picture. And this is that pretty girl right there. And I asked her, I said, how do you think she's doing? Did she ever look back, or did she ever develop any more symptoms? And she said, no, Dr. Lisa, I have to tell you, this hen is thriving, and she actually seems better now than before she had any homeopathic treatment. Cats. So Kit Kat is a case of a traumatic wound. She was, this is a case from my house call practice in Ann Arbor. On November 10th of 2014, Kit Kat, a 5-year-old spayed female domestic short hair cat who goes indoors and outdoors, presents with a stiff gait, lethargy, and severe pain on palpation of her dorsal lumbar and hip region. She has a decreased interest in going outside today, where the normal behavior of this cat is immediately as soon as the sun is up, she wants to be outside. She had a decreased appetite yesterday, and she's completely anorectic today. So, of course, what all of us are thinking is there's got to be an abscess somewhere. And I find palpable heat and soft tissue swelling in her left hip and left dorsal lumbar region. It's extremely painful on palpation. She has a stiff gait. She's reluctant to move. She's got decreased range of motion when she walks in her left hip. She's hiding. I actually did what I call in my practice an under-the-bed extraction, where I had to go into one of the kids' rooms and pull this kitty out from underneath a bed. Normally, this cat greets me at the door at my house call visits. So this is a very extreme shift in her personality. Normally, she's outgoing and friendly, and in illness, she is super grumpy when she's touched. She's hissing and trying to bite me, and I know we'd all like to know what this cat's temperature was as part of our exam, but there was no way. So here's my computer program showing the homeopathic analysis. I used what I felt was a pretty certain diagnosis of an abscess. I used General's abscesses, which brings us to 44 remedies that cover this rubric. Touch aggravates, because touching this cat aggravated her primary symptom. Want of appetite is a rubric that represents anorexia. The owner had also told me that she was lying in places that were very warm, and the owner had tried a warm compress versus a cold compress and felt that a warm compress improved her symptoms. And then I also used this symptom here, which is an emotional or behavioral symptom that says that when a patient is sick, they don't want to be around company. And that made sense based on this normally outgoing, affectionate, extroverted kitty being averse to the family, not coming out to greet me, and hiding underneath the bed. So the remedies that we see are, well, hey, this one looks familiar. Hepar sulf, Nux vomica, sulfur, and burrito carb. And so what I'm looking for here is, I know that this is an acute injury. And we will train you that there are certain remedies that are indicated, especially indicated for abscesses. And those two remedies are Hepar sulf calcarea and silica. And the way we differentiate these remedies when we're teaching our colleagues is the silica patient has an abscess and doesn't care if you touch it. And the Hepar sulf patient has an abscess and will try to murder you for coming close to it. And so this was very fitting for Kit Kat's symptom picture, because it addressed not only the abscess, but the aggravation from touch and these behavioral changes, the symptom of warm applications improving her symptoms, and her loss of appetite. And so you might be saying, I'm confused because I thought Hepar sulf was indicated for cases of bronchitis, not abscesses. Well, remember that these remedies, they have lots of indications, and the goal is not to treat the condition. Our goal with homeopathy is to treat the patient. So we can use the same remedy to treat an abscess wound in a cat that we can use for bronchitis in a chicken, as long as the entire symptom picture of the patient is represented by the remedy that we choose. So Kit Kat that day, I narrowly avoided being bitten and slashed to pieces. I gave her a single dose of Hepar sulf calcarea, 200 C. I gave this to her dry by mouth. I dropped the pellets in as she hissed at me. I told the owner, I'm leaving you with a couple of extra doses. I put them in a syringe dissolved in water because I did not think the owner would be able to give dry dosing. I said, why don't you give her a couple hours and then offer her food tonight and see if she eats. And if she's feeling better, the return of her appetite and increased energy will be her first signs of improvement. And remember, we're trying to stimulate a healing response in the body. So we don't want to keep redosing if the patient is improving. All we're going to do is give the remedy that matches the symptoms of the patient to stimulate a healing response, and then let the body, the vital force, do the rest of the healing. So I gave this owner some dosing parameters. I said, if she's still grumpy or she doesn't want to eat tonight, I'd like you to give another dose at bedtime. I asked her to give me a phone call the following morning with a progress report, and she said, well, her appetite still decreased, but she's eating better than yesterday. And I thought, that's still a persistence of a poor well-being, and even though we've seen some improvement, I think she needs another dose. So I had the owner give her a dose that morning and then repeat it midday and phone me the next day with a progress report. So 36 hours after her visit, the owner phoned and she said, well, she is so much better today. She's back to eating well. She's letting us touch her. She's socializing well with the other family members. And the abscess reabsorbed. The soft tissue swelling disappeared. It did not rupture out. So I told the owner to discontinue treatment and to call me if there was a return of symptoms. So let's talk about one of the things that we see often in our veterinary practices. I see this a lot in the emergency clinic. And even though it is an allopathic emergency clinic, I still can work my homeopathy magic in several ways. One of them is for wildlife, because we don't have any drugs that are suitable for wildlife. And I also, when I get a holistically minded owner who's concerned about the side effects of medications, I send them to the co-op with a list of remedies and treatment options. So in this case, I always keep a remedy kit with me at the emergency clinic. And February 17th at the ER, we had some Good Samaritans bring in a possum in a live trap that they suspected had been hit by a car. She had blood coming from her nose, she had wounds on her face, and she was reluctant to move. And I did some initial diagnostics, mostly based on a visual exam, pupillary light reflexes, the possum's behavior in general, and I concluded that he was shocky and the symptoms were indeed most likely consistent with being hit by a car. So arnica tends to be our go-to homeopathic remedy for most kinds of trauma in the initial stages. And so I gave this possum a dose of arnica. I put 5 pellets in water and dissolved them and drew them up in a 3 cc syringe. And through the cage bars, I squirted a little bit of this water into its mouth, about 1/4 ml. And then I kept it in the treatment area and monitored its behavior, its PLRs, its response to noise. What I'm trying to see is if it's going to start coming around and acting more normal. And it's hard to tell, right, because of that characteristic phrase about a possum playing possum, is sometimes when they're in situations that are scary, they will withdraw and act really quiet and play dead. But let me show you what happened 5 minutes after the first dose that I gave this possum. All of a sudden, this possum is a new soul and went from hiding and burying its head in this bloody towel to trying to crawl up to the top of the cage to greet me. This is a little video that I took of it. And you can see how bright and inquisitive and alert and responsive this possum looks, only 5 minutes after the initial dose of arnica. So you might be wondering, well, Dr. Lisa, why after everything you've taught us, if this possum is showing such improvement, why would you give a second dose? Let me tell you, I was not admitting this possum to the hospital. I was sending it back home with these Good Samaritans so that they could release it where they found it, preferably along the side of the road or away from the road so that it wouldn't get hit again. And so I gave a second dose because I knew that I wasn't going to put these Good Samaritans in a position where I was asking them to medicate wildlife. There was no indication that this possum needed a second dose. I just wanted to feel like I'd done something before I sent it out the door, hopefully ensuring a long-lasting response. But I'll tell you, from my experience, that second dose was probably unnecessary. The Good Samaritans called after they got back to their home, and they released the possum into the woods, and they said that it walked normally and acted like no trauma had ever occurred. So this is a very typical rewarding case that I see a lot in the use of arnica for traumatic injuries. So let's talk about horses. This case is a case of colic, one of the most common things we see when we're treating horses in our practice. And this is a case that comes to us courtesy of Dr. Stieg. She's the director of the Pitcairn Institute of Veterinary Homeopathy, and she practices in rural England in North Yorkshire. Penny, on May 27, 2014, she was a 25-year-old Shetland mare. Her presenting complaint was she'd been turned out on a new grass field today, and when she was brought in that evening, she was showing signs of colic. The owner described a bloated caudal abdomen, that she'd not passed any manure, and she was refusing to eat. And when the owner went to touch her belly, she acted extremely painful. This horse had no prior history of colic. In her panic, the owner called out the closest emergency practice, which was an allopathic vet. It came out and examined Penny, diagnosed gas colic, and administered a single IV injection of Banamine at 7:45 p.m. At 9 p.m., the owner contacted her primary homeopathic vet, enter Dr. Stieg, and said, well, I had the allopathic vet out, and she treated Penny, but we're not seeing any signs of improvement. Nothing's changed. She's not past manure. She's still painful. She won't eat. And so Dr. Stieg's instructions were, let's wait a little bit longer to give the Banamine the full time to have its effect. And I want you to wait until 2 hours after the Banamine. And if she is still showing symptoms, call me. And if she shows any signs of getting worse before that 9:45 time period, I want you to call me back. So following those instructions, the owner called at 9:45 p.m. and concluded that the Banamine had no effect on Penny's symptoms. So now we're going to work up her case, and we're going to go through her current symptom list. We have distension of her caudal abdomen, the abdomen being painful upon touch. Penny is normally a really sweet girl, and the pain was so severe that if the owner went near her caudal abdomen, she would try to bite her. She'd also noticed that she was burping. She'd done this 3 times in the last 2.5 hours, and she still had not passed any manure. So Dr. Stieg does a homeopathic analysis, and this is where she set up her computer program. This is still Radar Opus, but hers is set up a little bit differently than mine. Mine has colors. So here on my computer program, this would have been a dark blue because a 4 is a very high grade. A 3 would have been a slightly lighter blue, and a 1 would have been a very pale blue. So again, these are the symptoms that she thought were useful. We've got colic, eructations, distensive pain in the abdomen, and symptoms being aggravated by touch. And remember, in here, this is the list of remedies that fit this symptom. And then this is our list of remedies that match this patient's totality of illness. So number 1, we have Bell, which is short for belladonna. We have CHIN, which is short for China or cinchona. Cali-C is calicarb, and Acon is aconite, arsenicum, and ipecac. And so of this list, Dr. Stieg immediately narrows it down to belladonna because belladonna has intense symptoms, and it is very well indicated for patients that are aggravated from touch. And the most characteristic change in Penny's symptoms is that when her belly was touched, she was trying to bite, and this was an extreme change from her normal sweet disposition. It's important to note that in homeopathy, if Penny was always an aggressive horse and she was still aggressive with her colic, we would not have used this as a symptom of illness. We're only using it in this case because it's a departure from how she is when she's well. So Dr. Stieg tells her homeopathic client, who is well stocked in homeopathic remedies, to give a single dose of belladonna 1M. This is given at 10 o'clock. And the owner reports that in the first 5 minutes, Penny showed signs of beginning to relax. And within 15 minutes, she passed a pile of manure and started eating. And over the next 2 hours, her abdomen gradually looked less bloated. She was monitored throughout the night, but she returned to normal and no further treatment was needed. This is amazing, right? 1 dose of a homeopathic remedy, and we can stimulate a healing response, so the vital force does the fixing. The remedy is given, it stimulates the healing response, We see some normal gastric peristalsis. Patient passes a pile of manure, starts eating, the abdominal bloating is relieved, and the pain resolves. Now, some of you are asking, well, this is great for a bunch of acute cases, but I have a bunch of chronic, super challenging cases in my practice. And you might be looking to see, can homeopathy help? Absolutely. Ringo is a case from my practice. He was diagnosed with masticatory myositis in June of 2011. He was a 2-year-old neutered male golden doodle. His presenting complaints were that he had decreased range of motion in his masticatory muscles. He had severe atrophy of his masticatory muscles. The symptoms began within 1 month of a wellness visit with his veterinarian where he received multiple vaccines. And at that visit, he received 11 vaccines in 1 day. So after these symptoms started, the owner took the dog back to her regular vet, who prescribed a course of steroids, and the steroids temporarily relieved the symptoms, and then when the steroids were discontinued, the symptoms came back. So Ringo was referred to a specialist who on April 21st performed a 2M autoantibody test, which we can all realize was positive, and he was prescribed a 6-week course of immunosuppressive prescription of pred. Now the trick with homeopathy is that if we're using the symptoms of illness to choose our homeopathic remedy, how easy do you think it is for me to work up this case after he's been on 6 weeks of immunosuppressive therapy? So he's only finished the prescription 10 days before my homeopathic intake, and overall, the owner says he's a lot better. He doesn't have a lot of symptoms. The persisting symptoms that he has is that he carries his treats without chewing them. He will occasionally drop food or cry out when he's eating or chewing. He used to gobble up his kibble when he was well, and now he simply grazes. And since these symptoms started, he prefers to lie on cold tile. So based on any behavioral changes, I asked the owner if she's noticed anything different about him, and she says, nope, he still just wants to be the center of attention. But interestingly enough, he will frequently turn his head to the side as if he's attempting to yawn, and he'll get his mouth halfway open and he'll cry out. And the only thing that I could think of was that this was a symptom of Ringo trying to stretch his jaw muscles. So on physical exam, he jumped up frequently at me in a very energetic way, but he didn't bark. I found bilateral atrophy of his temporal muscles and his masticatory muscles. He had some resistance and pain noticed when the mouth was opened wide, but he could open it pretty well. And otherwise, his physical exam was unremarkable. So again, he's just been on 6 weeks of immunosuppressive therapy with prednisone. So what I need is to accurately prescribe for this dog. I need that prednisone to be out of his system, and I need to have some symptoms, right? So I asked the owner, why don't you start improving his diet? We'll start home cooking, and then I need you to call me as soon as his signs of illness return so that I can properly work up his case. Well, it doesn't take long. 1 month later, Ringo's jaw pain is back to the same level as it was prior to his steroid therapy. So I work up his case, I prescribe phosphorus 10M, and lo and behold, nothing happens. This dog does not get better. And so I presented all these great cases to you where we give a remedy and there's this great response. Well, not always. Sometimes our remedy choice isn't accurate. And one of the hardest things for us as homeopaths is prescribing after a dog has been on suppressive immunotherapy. It changes the symptom picture and it makes our prescribing more difficult. So, of course, the owner doesn't tell me right away that he didn't get better with his prescription. She actually waits a couple of months because she thinks that's how long it's going to take before she can see any improvement. And then she called me over Labor Day weekend and lets me know that he hasn't gotten any better over the past 2 months. So I work up his case again, and I think, you know, all of this started after a lot of vaccines, and so maybe I need to look more closely at a vaccinosis remedy. And remedies for vaccinosis are those that are specifically indicated to treat patients that have chronic disease symptoms after vaccines. So one of the most common remedies that we see being needed, especially after rabies vaccination, is one called Listen, which is actually made from the product, which is a product of the saliva of a rabid dog. So I was feeling pretty confident that this matched all of Ringo's symptoms, and I gave him a single dose of a 1M Listen on September 9th, 2011. And look at how quickly this patient's well-being improves. Even with chronic disease, within the first couple of days, we will often see our patients show improvements in their well-being. The owner emails me and says, well, Ringo seems a bit better. I don't want to get my hopes up, but he seems to have his energy level back again. And I said, that sounds pretty good. Why don't you send me an update in about 4 to 5 days? So day 7, after his single dose of Listen, the owner reports Ringo seems to be a lot better. He has all his energy back, and he isn't yelping when he yawns, and it seems a lot less painful. And then 2 weeks after his homeopathic treatment, we get some exclamation points. Ringo is definitely doing better. He has a ton of energy, his mouth is opening a little wider, and he doesn't seem to be in as much pain. So I am rechecking this dog frequently, every couple of weeks, and at the 6-week evaluation, I can tell you he's barking completely normally, which he hadn't done when I first met him. He's able to fully open his mouth without pain. The owner reported that yesterday he grabbed a piece of candy off the table, and she took for granted the previous inability of him to open his mouth. And she said, I pulled his mouth right open, and I grabbed that candy out of his mouth, and I suddenly realized he can fully open his mouth again. I asked her to estimate how much range of motion he had back, and she thought it was about 75%. And she sent me a cute video of him playing ball. She said this was one of his favorite games, is that they would toss a tennis ball between the kids in the house, and Ringo would catch it, and then he'd chase the kid around the yard, tagging people with the ball in his mouth. So the most recent recheck that I did on Ringo before I moved to a new part of the state was in January of 2016. So this is 5 years later after his homeopathic treatment. His jaw pain has never returned, and despite the muscle atrophy that occurred at the time of illness and persisted, he's had no trouble or pain fully opening his mouth. And at that time, I was treating him homeopathically for waxy ears, which is something a lot less dangerous than masticatory myositis, so I'll take it. Let's go back to Dr. Steeg's practice in North Yorkshire for a case of equine strangles. On August 4th, 2012, Marmite, a 2-year-old filly who's a standard-bred crossed with a French trotter, is at a horse breeding facility that's had an outbreak of strangles on the property. And every time they think they've gotten it under control with allopathic treatment, they have another outbreak. Marmite's presenting complaints is that she's got acute submaxillary lymph node swelling that is significantly worse on the left versus the right. She has a palpable soft tissue swelling underneath the left maxilla that's involving severe swelling extending to her left cheek and her throat latch region. Her overall symptoms include lethargy, malaise, and a decreased appetite. The owner was offered further diagnostics, but she declined. So based on these symptoms and the characteristic appearance of this wound, Calcarea carbonica 10M was prescribed in a single dose. And why did Dr. Steeg know this immediately without even having to work up the case? Well, equine strangles is a glandular swelling disorder involving abscesses in the deep muscles. And Calcarea carbonica is selected for its affinity to treat glandular swellings, especially below the jaw and the neck, with abscesses in the muscles and painful swelling and separation of the submaxillary glands. You couldn't pick a remedy that is a better description for this case. And this picture is standing underneath Marmite. So her nose is down here, and here's her throat latch, and this is her left cheek and her left side of her submaxillary gland, and this is abscessed out and draining. So a single dose of Calcarea carb is prescribed, And within 24 hours, the owner reports that she's become much brighter in herself. She has a returned interest in feed, and the swelling around her cheek and throat latch region has significantly improved. 48 hours later, the abscess has ruptured, the swelling has further reduced, and Marmite is showing a complete return to normal behavior. And her healing response continued following that one dose. The draining abscess and all swelling resolved between 4 to 7 days after the remedy, and no further treatment was needed. And this is a picture of Marmite taken sometime later in her return to health. This is our last case. This shows us how homeopathy can be used to treat not only acute and chronic illness, but symptoms of behavior problems, one of my favorites, and actually developmental disorders occurring in a patient. So Taz is a 4-year-old neuter male border collie who comes from a working line. And he's got a huge list of presenting complaints. He has what the owners describe as problematic behavior, which includes fearful, anxious behavior. He's noise sensitive, and when he is stressed, he displays fear-aggressive tendencies. On physical exam, he also has a developmental condition resulting in an overbite, which was classified as a Class 2 malocclusion, mandibular disc occlusion, resulting in a significant overbite, giving him a shark-like appearance to his mouth. His mandible was displaced caudally by more than 2 centimeters. A more accurate measurement was a little bit difficult because this dog looks like he wants to bite you in this picture, doesn't he? Looks very fearful. And so the owners reported that 100% of the time his tongue is protruding to various degrees because of his disc occlusion. Now let's move on to his behavior symptoms. The owner says these were first observed at 4 to 5 weeks of age by the breeder, and despite extensive training and behavioral modification, the symptoms are not better by 4 years of age. These are experienced owners. They're experienced in owning border collies that come from a working line, and all of their work could not change Taz's behaviors. He's wary of people. He's fear-aggressive with strangers approaching when they're walking on the street, entering the home, and he's been known to run and hide from strangers. The owners describe him as hypersensitive, hyperreactive, and when he's really stressed, he'll urinate when he's petted. He panics whenever there's raised voices or shouting, and he'll also demonstrate displacement activity. When he's stressed, he'll chew his front legs. Another thing the owners thought was strange was that he was never interested in playing with other dogs, either new dogs he just met or the 3 other housemates he'd lived with for years. So Dr. Stieg did a couple of homeopathic analyses, and the first one focused on 1 mental symptom and 1 developmental symptom. And it doesn't necessarily matter that we localize this to the jaw. The disc occlusion in and of itself is represented by a rubric called dwarfishness, which represents developmental and growth disorders in the patient. And then this mental symptom of fearsome, anxiety, dread, frightened easily has 117 remedies that are represented in this rubric. And so here our top remedy choices are burrito carb, calcarea, phosphorus, sulfur, natmir, and so on. And then down here we have another analysis that includes a dwarfishness rubric. Now this is from another repertory, so you'll notice that some of these rubrics are a little bit different. This rubric has 13 remedies for dwarfishness, and this one has 19, so some of this can vary depending on the repertory that you use. And then she played around with different mental symptoms to try to describe Taz's behavior. And interestingly enough, we see some overlap of remedies. We are seeing sulfur again, we're seeing burrito carb come up, calcarea. So the fact that she's doing 2 separate analyses and seeing some repetition of remedies will help her narrow down her choices. So based on her knowledge of remedies and her case analysis, she selects a single dose of burrito carb in a 1M potency. And she selects this because some of the striking symptoms of burrito carb as a developmental remedy is that there's this characteristic lack of mental and physical development from a very early age, almost as if the patient was frozen in their maturation process. They demonstrate fear and hiding behaviors. They're easily frightened and afraid of strangers, and cowardly, but interestingly enough, will show sudden symptoms or bursts of anger that are coupled with cowardness, which is a great description of fear aggression in dogs. Burrito carb patients also demonstrate an extreme oversensitiveness of all of the senses, including noise and voices. And another characteristic representation of this remedy is a child that does not want to play, which Dr. Stieg felt was really appropriate considering this dog lived with a bunch of other dogs and never wanted to play with them or new dogs that he met. So after this one remedy, the owner reported that off and on, over the next 3 months, she would notice Taz displaying this new behavior where he would intermittently rub over the bridge across his muzzle. He started intermittently drooling excessively and also was eating slowly for several weeks after the remedy. And then the symptoms seemed to improve, and then they reoccurred again after about 3 months. Upon recheck, 2.5 months after the remedy, amazingly enough, even though this dog received this remedy after his growth plates had closed, Dr. Stieg found that only a very slight overbite was remaining. And by 4.5 months after the remedy, his overbite disocclusion had completely corrected itself. The owner also noticed some improvement in his behavior symptoms. Within the first few weeks, she saw a general increase in his confidence with people, his tolerance of raised voices, and that response continued to develop to the point where he was even playing with other dogs. There became a hierarchy shift in the pack where he was no longer the bottom of the pack. He started coping better with the world and excelling in training. And by 6 months after his remedy, the owners reported that he was the best behaved dog in a home of working dogs. November 26, 2014, Dr. Stieg repeated the burrito carb in a higher potency based on a minor increase in hyperactivity behaviors and wariness of people. And again, Taz responded well, gradually improving over several weeks with generalized increase in his confidence and becoming more relaxed again with people. And currently, the owners classify his behaviors as within normal limits for a working border collie breed. So thank you very much for joining us for our presentation tonight. I just want to summarize that our goal with homeopathic treatment is that we match our homeopathic remedy to a patient's complete symptom picture. And the goal is that the remedy must create the same symptoms of illness in a healthy patient as the sick patient we're treating. And this concept is based on similia similibus curantur, the basis that a similar remedy will stimulate the vital force to cure the patient. This results in a healing response, a rebalance, and a return of well-being. And then the patient, as a result of not suppressing the symptoms of illness, achieves a higher state of health, and homeopathy gives us the ability to cure our patients. For those of you who want to learn this fantastic modality for yourselves and incorporate it into your practice, the Pitcairn Institute of Veterinary Homeopathy offers a professional course in veterinary homeopathy. This is led by Dr. Richard Pitcairn, who you've met tonight, and his team of faculty instructors. It consists of 5 4-day live classroom sessions over a 15-month period, which results in 160 hours of classroom instruction. And then in between these sessions, we have an integrated classroom and multimedia program. We use the live classroom sessions to teach you the concepts, and then we follow up in between the sessions with webinars. We also offer each student private tutoring sessions with the faculty instructors, homework studies so that you can immediately begin applying the concepts that we teach you, and then we'll have you start studying clinical cases from your own practice. And then we will test comprehension and understanding so that we know where to work harder to better teach you using exams at each session. So if you're ready to start, we are still accepting enrollment. We do have some spaces left for the 2021 course. which begins in the summer of 2021 in Portland, Oregon. And there's lots more details on the website at pivh.org. Once you complete the veterinary homeopathic training, there are advanced options for certification offered through the Academy of Veterinary Homeopathy, which we call the AVH. This is a 1 to 2 year process following graduation of the PIVH course. It requires the graduates to submit 4 cured cases. 2 are acute and 2 chronics. And then once those cases are accepted, a written exam follows. There's also continuing education for veterinary homeopaths. We have the PIVH annual advanced meeting, and then we also have the AVH, which is the Academy of Veterinary Homeopathy, also has an annual meeting, and we have a journal. For those of you who can't wait till 2021 and you want to get started right now, this is how I got started. This is how I found out about homeopathy, was Richard's book, Dr. Pitcairn's Complete Guide to Natural Health for Dogs and Cats. This is now in its 4th edition, and I would highly recommend the 4th edition. There's also the Practical Handbook of Veterinary Homeopathy by Wendy Jensen. She's one of our faculty instructors. She is an amazing teacher, and she wrote this book, and it's so good for everyone, no matter what your experience level is. I found it to be very educational as a homeopath myself, and I also have had some of my clients read it who know nothing about homeopathy, and it speaks to them on their level as well. There's also a good book called Homeopathic Care for Cats and Dogs, Small Doses for Small Animals, written by Don Hamilton, one of the early graduates of the professional course in veterinary homeopathy. And then for those of you who are looking for advanced reading, I would highly recommend The Science of Homeopathy by George Vitulkis and The Organon of the Medical Art by Samuel Hahnemann. And a lot of the books on this list are required reading for the professional course, including Wendy's book, The Science of Homeopathy, and The Organon of the Medical Art. These are just some resources for you if you want to explore some homeopathic websites further. Again, the Pitcairn Institute of Veterinary Homeopathy gives you all the information you need about registering and taking the course beginning in 2021. It also shows some great case examples presented by the faculty. And then the Academy of Veterinary Homeopathy, the avh.org, people can go to that website to find a veterinarian in their area that practices homeopathy. So I wanted to thank you very much for your time and your attention and your interest in homeopathy.
And then some people are thanking you. That's one thing. It's a fantastic presentation.
Thanks, everybody.
Yeah, so that's good. It looks like that was well received. Well, thanks you all for attending. There you go.
Thank you, everyone.
Again. I think we'll stop the meeting at this point. Thank you so much.
Thank you.